Dr. Aino, for the introduction. I'm still going to try to join from another device just to be able to put up the video as well. But I will start share my screen so we can get into the presentation.
Okay, thank you.
Okay, so I'm using one device to present and I'll be using the other one just so we can have some video as well. Okay, so can you hear me?
Yes, we can hear you.
All right. Thank you. Okay, so today we'll be talking about an important topic, like Dr. Aino said. In other countries, you call them when you hit a certain age, and they try to ensure that you get some tests done. All of this is just to ensure that you remain in good health and sound mind, really. The idea is for you to age gracefully. Let me put it that way. And here in Nigeria, we don't really have that structure yet. And there are a lot of tests out there. There are a lot of people out there telling you to come do different things. And this is just about highlighting some of the very important tests that you should do from time to time as a man or a woman. Some tests are very specific to your gender, and some tests are general, like anybody can do them as well. So I'll just move into the topic and then we'll just proceed from there. So I think one of the most important questions would be, why should you do health checks? I mean, why? Dr. I know you already highlighted something about being called once you hit a certain age, so that you just check you and know that everything is fine. This is because, as we progress or as we age, our bodies change. There's this favorite saying my mom has that she says it in her language, but I'll just translate it to English. Basically, that it's not the body you come into the world with that you live with. So throughout life, as we progress, as we grow older, our bodies will change. And as a result of that change, due to the wear and tear of life, our organs and some things will not work as well as they used to. There are many things we can do to slow down that process, or to ensure that even as our bodies undergo wear and tear, that they still remain functional and they still do what they're supposed to do. And one of the ways to do this is through these annual health checks, or through this health test I'm going to talk about anyway. What this health test will do is to just pinpoint some very specific and important things that you must check, that we found over time that are common culprits when it comes to ill health or aging in a poor way. So that's why it's important for you to do health checks, just to ensure that everything is fine. Not every disease condition will start like malaria, that you begin to feel a certain way and then you have some symptoms and you feel it's malaria, and then you go to the hospital and get tested and you're right. More often than not, especially diseases that have to do with getting old, they are more insidious. They're more slow in onset, and they often don't make a lot of noise. They just creep in slowly, and then one day, if you hear someone had a stroke, I can assure you that the stroke did not start that day. Most times, the stroke did not start 5 years ago. Whatever caused that stroke has been on for a longer period of time, say 10 years, maybe even 20, and it's just manifesting that particular day. So moving to the topic, I'll start with the females. So there are particular health tests that are important for females to do. I'm going to also try to highlight them based on age as well. But I think the most important thing is, for instance, the self-breast examination is something for every woman, regardless of age. It's important for every woman to do. And why? In Nigeria today, breast cancer is the leading cause of death among women when it comes to cancers. It's really deadly. And globally, breast cancer is a problem everywhere. There are some people that have a gene, we call it the BRCA gene, that may predispose them to having breast cancer. And so that's why we're always very particular. If you have a relative, first degree relative, like a mother or a sister, blood sister now that has had breast cancer, you want to get examined even more frequently. But generally, as a woman, it's very important to know your breasts. And the only way you can do so is by doing regular self breast examination. I've also tried to like put a picture. I hope it's clear. You can also Google it, how to do self breast examination. But the long and short of it is really around maybe standing in the bathroom or in your room with a mirror in front of you. You just want to examine your breasts, note the shape, note the size. The thing is this, it's usually best to do self-breast examination for women that are still having their periods, some days after your periods, when your breasts are not so tender or painful, or maybe they've not increased, they're not, because some women may have swollen breasts as a result of their periods, or they may have tender breasts. So it's best to do the self-breast examination after your period, some days after your period, so you can examine. What are you looking for when you examine? You're looking at the skin. Is the skin the same color? Is it even? Or is there any change in the coloration of the skin? You are looking at the shape and of your breasts. Is there any change in the shape of your breast? Now, that's why I said know your breast, because if you don't know what is your normal, then you will not be able to easily pick up when something has changed. So it's very important for you to know your breast. Stand in front of a mirror. Don't feel shy. If you're a man here, you can also assist your partner in doing that, because maybe you feel shy or anything, but it just really helps to be able to know your breast, so that if you pick up a lump, you can easily report it. So I spoke about the skin, the color of the skin. I've spoken about the shape, and you also want to know the size, because if it's increasing in size for any reason whatsoever, and then when you're examining, you want to be methodical about it, depending on what you read online. But usually you just want to divide the breast into like 4 segments. You divide the breast into like 4 segments. So there's just like draw an imaginary line across the breast from the top to the bottom, passing through the nipple, and then draw another line again across, so horizontal and vertical. And so you just want to examine the breast in each segment. So if you're able to do that regularly, monthly, I encourage you to do it monthly, so that you get familiar with your breast. And if you pick up any lump or any issue, anything abnormal, we can then address it. Now, which leads me to some of the other things that we can do for women. If you are under the age of 40, you pick up any abnormal lump, you definitely want to show up at the hospital to have a breast scan. Now, when the breast is scanned, we encourage women under 40 years to do breast scans, and we encourage women over 40 years to go for mammogram. And this has to do with the density of the breast tissue. In younger women, the breast tissue is more dense, so the scan is better for them than in older women. And so these are some of the things about the breast, and that covers for breast cancer, and it can also cover for breast lumps or any other issues that you may be having with the breast, because it's not just breast cancer alone, but it can also just be some lumps that may just need to be removed. So that's an important test as a woman that you should do. Another important test you should do as a woman is the pap smear. Now, I don't know if anyone here has heard of the pap smear before. If you have, you can just drop a yes in the chat section. It will help me to also know how to present this as well. Okay, so I can see some people have dropped yes. That's great. I'm happy that we've all heard, or at least a couple of us have heard of the pap smear before. So the pap smear is also a very important test. We do it, we encourage women in the reproductive age that are sexually active to do pap smears regularly. How regularly? Would say roughly maybe less than 50, 60, you should do it about every 3 years. And then greater than 50, 60, you can do it every 5 years. Why the pap smear? The pap smear is a test that really just checks for the it looks at the cervix to see if there are any changes. Now, what we are really screening for when we do a pap smear most times is we're screening for cervical cancer. Now, cervical cancer has been found or has been associated with something we call HPV, human papilloma virus, HPV. And we found that if we do these pap smears regularly, it will be easy for us to pick up any changes that occur in the cervix that will be caused by this HPV. If you follow me, I've said HPV causes cervical cancer. This is one of the biggest culprits when it comes to cervical cancer. Now, it will usually cause some changes in the tissue around the cervix. So that is why when you do a pap smear, when they insert the speculum, they put a brush to just take some sample of the tissue around your cervix to see if there's any change in those cells. We are looking for those changes because if there are changes and we catch it on time, it is something that is very, very treatable. But the problem is that more often than not, most women that come down with cervical cancer, they don't catch it on time. So by the time it's caught, it has advanced and it becomes more difficult to treat. Survival becomes a more tricky thing. And honestly, it can be quite devastating. It's also a very fatal cancer, just like breast cancer. And if I'm right, I think it's about it should be about the second leading cancer in women, cause of death in women. I think we can check that just to be sure. But cervical cancer is really a big deal. And it's amazing that with something as simple as a pap smear, every 3 to 5 years, you can actually protect yourself from this. I always tell women as well, those that have daughters less than 18, in fact, women up to the age of about 26 can take the HPV vaccine. So there's a vaccine that has come out now that can protect women from the HPV virus that causes cervical cancer. So if you have a young daughter from 9 to about 18, even up to 26, they can actually get this vaccine. And you can get this vaccine in any very solid private hospital around you as well. Just go and ask for the HPV vaccine, HPP for pillow vaccine. So I think it's very important to put it out there because if we have more people taking this vaccine, we can actually bring down the cases of cervical cancer to almost 0 in the near future. So that's really vital information. So these are some of the tests that are quite women specific: the self-breast examination, the breast scan, the mammogram. We've spoken about the pap smear as well. These tests are quite specific to women, and it's very important that you do them regularly as a woman to ensure that you remain in good health and sound mind. We're going to look at some other tests for men, after which we'll then look at some tests that are general. So for the men, there are not so many. Sorry about that, men. That's just the way it is. So for the men, we have first the testicular examination. So just the same way we encourage women to know their breasts, we also encourage men to know their testes. So what this involves is doing a self-testicular examination at home. Why? Because testicular cancer is a thing, and it can occur in young men as well as in men that are older as well. So it's not a thing that, oh, it's just for old men. So even if you feel you're too young to have it, it's very important to also know your testes. There's also a picture here. You can do this in the shower while soaping yourself up. So you want to get to locate the structures of your testes, and you want to get to understand how your normal testes should feel. And if you now feel any lump or you feel pain whenever you're examining, you definitely want to go to a doctor to get it checked out. So this is something that is very important for you as a man that you should do regularly, because honestly, with regular examination, you can pick up any abnormalities, pick up any lumps, pick up any defects that may be affecting you as well. So important to know your testes. Another important test for men is the PSA test. So this PSA test, there are different schools of thoughts around it at the moment. Some would say that it's not in developed countries, they do not routinely do the PSA test for men anymore. But if as a man you ask for it, to be done for you in countries like the UK. But in countries like Nigeria, where I feel we don't have the best of health systems, and we don't have the best of organization and all of that, I think as a man, to be on the safe side, it will benefit you more to do your PSA tests regularly, and also to look out for signs of prostate enlargement, because the PSA is what we call prostate specific antigen, and it just helps to check the level of a substance produced by the prostate in the blood. If it is higher than a particular number, it tells us that this person's prostate may be enlarged. Okay, and the enlargement may be due to, may just be a harmless thing we call BPH, benign prostatic hyperplasia, which just means that the prostate is bigger than it should normally be. It may also be due to prostate cancer, which is a very deadly cancer among men in Nigeria. As a doctor, I have seen patients with prostate cancer. I have seen patients with cervical cancer. I have seen patients with breast cancer. And I can tell you in all honesty that if you can do these simple things and help to protect yourself, it will go a long way in helping you. And they're very simple tests, but I think that they are also useful tests to just protect yourself. Apart from the PSA test, there's also what we call the T2 rectal exam, but it's not something you would do for yourself. It's something that will be done for you in the hospital. And that's if you also have some symptoms or some complaints. So that's why I haven't gone into that. So that's what's for the male aspect. Those are some of the tests that we can do, or we advise men to do. And there are other tests as well. There's a test for colon cancer. Usually we call it a fecal occult blood test. And basically, it just involves dropping a stool sample in the lab, and that will be checked to see if there's any indication or anything that may indicate that this person may have something going on in the digestive tract, and we will now want to investigate further. Again, it's a rough test. It's not a very accurate test, but it can be very useful, especially if you have a history of having colon cancer in your family, maybe a first-degree relative or second-degree relative, and especially a first-degree relative, because that's a very strong association, like we'd say in medical terms. It helps for you to be regularly screened for colon cancer. The way we usually say it, if your first-degree relative was diagnosed at 56, you want to start getting screened from 46. So remove 10 years from whatever age your first-degree relative was diagnosed with colon cancer, and you want to start your screening from that age. It doesn't even hurt to start it earlier. And the simple screening for colon cancer can also involve what we call a colonoscopy, which involves putting a flexible tube. Just think of a garden hose like they used to wash cars or at car washes, and just imagine they fit a light source like a small bulb, and then there's also a camera as well. So we put something that flexible, either through the anus when you're doing a colonoscopy, lower colonoscopy, or through the mouth if it's an upper gastrointestinal endoscopy. So basically what that just does is, with the light source and with the camera, we're able to look at your digestive tract, notice or pick up any abnormalities, any growths, or anything that may look cancerous or dangerous, and they can take a snippet of it and actually send to the lab and get it tested. And it's a very important test, especially if you have a family history of colon cancer. Let's also go to some other general tests. Now, there are many things, and when you were coming here today, you may have thought of all the million tests that you may have in your head, that you've heard that are important, that you should do regularly. Truth is that the tests are inexhaustible, but I've tried to pick what I'll call the high yield ones. And what I mean by that is I've tried to pick the tests that are very important and will be very useful to you as a person, that if you do this test, you'll be covered for a lot of very common problems in our environment. So the general tests that we'll talk about, first, your blood sugar. In Nigeria, diabetes is a big problem. We have a lot of people that are coming down with diabetes every day. And I mean, as simple as a blood sugar test, you go to the hospital or go to the lab and say you want to do a blood sugar test. They just take a prick and they check And it's usually advised you to do fasting. That's before you've eaten, usually before 10 a.m. in the morning. That's usually the most advisable time. You wouldn't have eaten anything that day. You just go do a fasting blood sugar. Let's just check your sugar level. It tells us a lot and can help us screen for diabetes. Another test, very important. I mean, it's very simple, but it honestly goes a long way, is blood pressure check. Now, blood pressure is a very silent disease. Unlike diabetes, people that have diabetes can have some symptoms. They may start peeing a lot. They may find that they're very thirsty. They may lose weight. But with blood pressure, there may be no symptom at all. And I've seen countless people come in with 200 over 110 and they don't have any symptom. They look normal. So blood pressure check is something you cannot overlook. I feel like based on the fact that we are 17 or 19, 18 in this place, and the stats say that 1 in 3 Nigerians has high blood pressure. So it goes without saying that out of 18 of us, if you divide 18 by 3, it gives you a figure and it tells you the number that may or at the risk of having high blood pressure here. So it's very important. If you've never checked your blood pressure in your life, please today, after this conversation, try to walk up to a pharmacy close to you. I always recommend pharmacies because these days most pharmacies have like a BP machine they can use to check your blood pressure. So check your blood pressure just to be sure it's normal. Now, the normal blood pressure should be less than 120 and less than 80. So you want to check your blood pressure to be sure everything is fine. Another thing that you should also do is what we call the BMI, the body mass index. Now, the body mass index is a way of knowing if your weight is healthy or not. And it's really simple. You check your height, you check your weight, and then it's a calculation. If you go to the hospital or a standard lab, it can easily be done for you. And it helps you to know if you need to lose weight or you need to add weight. For most people, tend to be on the side where they need to lose weight than on the side where they need to add weight. And you may ask, why is this weight so important? Your weight can predispose you to a lot of conditions like even hypertension, diabetes, like I've already pointed out earlier. So checking your BMI is crucial to even avoiding some of these things. In fact, some new research even indicates that being overweight can also increase your chances of even, say, having a cancer. So there's just a lot that being overweight can do. If you can really help it, checking your BMI is one way to monitor your weight and ensure that your weight is healthy. And if it isn't, you can take the right steps to get back on track. So the tests or the list of tests that you can do are endless. If you feel like there's any test that I've not covered, you can just drop a comment and we can also talk about that as well. But I feel like one of the best ways to just try to capture most of these things as much as possible is by going for an annual health check, just to get everything checked as much as possible. And you can capture a lot of these very important high-yield tests that can help screen you for any disease and also help to keep you healthy for a longer period of time. Because most times in medicine, early detection or prevention is very crucial. If you cannot prevent the disease, at least the very least you can do is to detect it early enough for us to be able to take the right steps to ensure that you stay healthy. Yes, thank you for the cholesterol. We also check cholesterol. I think I just lumped some things under an annual health check. So your cholesterol check is very important, especially for those who may have an increased risk of having a cardiac events, like people that have a higher chance of, say, having a heart attack, and that's people that have like high blood pressure, especially when it's not controlled, people that are overweight, and then there are some people that in their families, they have high cholesterol levels. Like it can be a familial thing. So in such people also, you also want to monitor your cholesterol levels and ensure that you're doing the right things to keep it down. Why is it important to monitor your cholesterol? If your cholesterol is too high, it can affect the flow of blood in your body. It can actually even lead to high blood pressure. It can also increase your chances of having a stroke or having a heart attack because it can block the vessels prevent the free flow of blood in the blood vessel in the heart or even in the brain, and lead to a stroke, lead to a heart attack. It can cause so many problems. It can even affect the flow of blood to some other parts of your body. So cholesterol is a very important check. You can still drop any more tests you feel like you want me to cover. But I think at this point, from my own end, I've finished or I've exhausted the list of the tests that I put together, apart from any other test that you may want me to talk about. So if you have questions or other tests you want me to talk about, we can do that now. Thank you very much.
Thank you very much, Dr. Oyo. Thank you so much. I know that if everyone tells 10 people and everyone does these tests, a lot will be prevented. Do we have any questions?
Yes.
Please go ahead.